Hello, so my name is Carl Calabrese. I'm a physical therapist, orthopedic certified specialist. My intent today is to talk to you about protecting knees, protecting futures of adolescent athletes, specifically talking about ACL injuries. So why does this matter? ACL tears are increasing, and they're one of the most common injuries in all of youth sports. Females are actually 3 to 4 more times likely to experience an ACL injury with sports that pertain to cutting and pivoting type sports. The consequences often not talked about or thought about, lost seasons, potential scholarship impact if they are, in that age and the ability to play at the next level. Surgery itself, and then the rehab and the recovery is anywhere between 6 to 12 months. 6 being on a very, very, very early end of it, 12 being more normal. It can actually take some up to 2 years to get back into the playing field. So um, those are some of the short-term things. Actually, and the longer-term things is after you have an injury to your ACL, potential surgery. The risk of osteoarthritis in the knee actually increases significantly. The thing that's not talked about enough, in my opinion, is that we can prevent many of these with short, consistent training. Um, a lot of these can actually be prevented. So, what is the ACL? So, ACL, so anterior cruciate ligament, kind of helps stabilize the knee. It often is injured during sudden deceleration, so running quick, slowing down, or landing from a jump, cutting, pivoting. Non-contact mechanisms are actually the most common type of injury. Actually, up to 76% of injuries to the ACL are actually non-contact, meaning there's no collision involved. So as we talked about, the short-term consequences, surgery, most of the time, that's what's going to be indicated if it's a full thickness tear. Partial tears, you may be able to spare yourself from surgery, but the rehab and the recovery is still months. So often a lost season at the very least if you can prevent surgery. The rehab is anywhere between 6 to 12 months, and the longer you wait from that 6 to 9 month range, actually the risk of re-injury actually reduces. So uh, my recommendation, not going back any before that 9 month mark. If you can wait a full 12 months, that's going to be absolutely what's best for uh, these individuals psychologically. A lot of athletes are impacted as a result of that, always thinking, always wondering, fearful. It takes a lot of courage, and there's a lot of levels of mental hurdles that need to get overcome to get back on the field. Often not talked about, but a big thing that I think is pretty clear when you watch someone go out there that is a little hesitant to go out there. You can actually see they're a little slower, they're a little bit not quite themselves. And over time, they start to build a lot of times that confidence back up and they get back to hopefully that same level. And as they develop, even progressing to maybe potentially even a better athlete, but that's not a consequence of the ACL injury. It may be more of a consequence of all the rehab and the recovery that they need to undergo. And oftentimes athletes learn how to actually lift and train and take care of themselves after an injury like this. So, uh, re-injury is a real risk. It can be up to 24% of ACL ruptures that have surgery actually re-rupture. You are actually more likely to injure the opposite knee, believe it or not. That's for multiple different reasons. Some think what's called the proprioception in the surgical leg is lost, so you're kind of relying a little bit more on the non-surgical leg. There are still some asymmetries that weren't identified during the rehab process. That may be a piece of it. And like I mentioned before, risk of osteoarthritis and also the cost. Surgery is not cheap. The rehab, the recovery is not cheap as well. Um, so the big thing here is preventing, right? So non-modifiable risk factors are things that we cannot control. So age, the highest risk is in adolescence. So if we teach our adolescents how to uh, do the right things and we take care of those modifiable risk factors, which I'll talk about here in a moment, we can actually reduce the risk of injury. Sex, so female athletes, like I mentioned, 3 to 4 times more likely to suffer an ACL injury. Once again, not one of those factors that you can actually modify. The anatomy, the Q angle or the angle of the pelvis. Some people are built with a little bit more what we call ligamentous laxity, or they have a little bit looser collagen. The notch where the ACL goes through, maybe a little bit smaller on some. A familial history, large growth spurts over a period of time. All these are things that you can't control, but may contribute to the risk of injury. Now, the reason why everyone's listening here, things are the modifiable risk factors, the things that we can control. So there's things called the hamstring to quadricep ratio. So how strong the quad is in relation to how strong the hamstring is, and keeping that ratio in a range that kind of helps both of them do their job appropriately, where you're not too dominant in the hamstrings, which is typical, versus too dominant in the I'm sorry, but you're not too dominant in the quadriceps versus under dominant in the hamstring. So you want that good ratio, especially during development and as we grow. Weak hips, core often lead to poor knee stability. Just mechanics, right? That dynamic valgus and that knee diving in, not allowing those knees to drop down, those hips to drop down to allow the muscles to absorb the shock of the land. Um, Landing a little bit stiff is going to increase the risk of actually rupturing ACL, and not to mention you're putting more stress on the joint itself. Fatigue. So playing a lot of sport over time, at the end of the game is more likely to suffer an ACL injury, but the same is true if you're constantly going from sport to sport or you're playing multiple sports at a time. You don't give yourself enough time to rest and recover. You're actually putting yourself more at risk. Um, Flexibility. So as we grow, if we're not respecting the soft tissue and working on the mobility there as well, and not just that, but I guess in general, it can lead to some compensations that may put you at potentially risk of ACL rupture as well. And these are all things that you can handle and that we can address. Um, so sport and training risk factors. So early specialization. This is a problem that we have in youth sports is uh, athletes become very one specific or two sport specific athletes instead of being over or overall well-rounded athletes. So it's important to play multiple sports, give yourself some time to recover. Um, Overtraining. You see people in the gym or they're doing a whole bunch of workouts back to back to back. That rest and recovery is how your body's going to rebuild. And if you don't give yourself that time, then you're actually doing yourself a disservice. Um, Lack of rest between sessions, like I alluded to, if you're kind of going back to back, um, that's really not the most optimal thing. And nowadays, athletes will play multiple different leagues of the same sport at the same time. So you may have several games in a day, and just that repetitive play and not giving yourself that time to recover. You are putting yourself at more and more risk of injury as time goes on. A lot of times, this is a piece that most athletes don't enjoy. It's the warm up piece, but that's one of the more important things that you can do is to get your body prepped for sport. Is that good dynamic warm up? So prevention does work. So what I'm going to talk to you a little bit more about is the neuromuscular training program. So it incorporates a few different principles, but you can actually reduce the risk of ACL injury anywhere between 40 to 75%. The key is consistency, 2 to 3 times a week, working on quality over quantity, having someone there that knows how to coach mechanics, give the right cueing, and make sure that the athlete or the individual are performing all tasks properly. And a lot of times it'll involve performance, it'll be agility, it'll be jumping, landing, accelerating, uh, cutting, those kinds of things. There's evidence-based programs out there, the FIFA 11. So if you're a soccer player, this is a really good one. It's a good structured warm-up prior to playing. Sports metrics, it's plyometric, it's strength, it's technique focus. There's a lot of good evidence out there, especially in female adolescents. Um, uh, you know, uh, Bottom line is this is straight from the APTA clinical practice guidelines. You got to incorporate strength. You got to incorporate plyometrics. You have to incorporate core or proximal control, balance, and then mobility as well. So the core components of a good program: dynamic warm up. That's your movement prep. That may be A skips, B skips, open up the hips, but it's essentially stretching and movement at the same time. Strengthening. It's not just the knee, it's the hips, it's the hamstrings, it's the quads, it's the core. Doing things like Nordics, which is a heavy eccentric or controlling the body. Um, as you descend, the torso descends towards the ground, really hits a good eccentric control of the hamstrings, squats, lunges with great control, working on hips, knees, and ankles right in line. Plyometrics are also a vital piece of this. So that's your jumping, landing, with the emphasis on technique. You're looking for those hips, knees, and ankles to kind of be in a line. You're not looking for that dynamic valgus. We're working on depth and control, nice soft landing. And the same thing with the agility and the deceleration, those cutting movements. We're looking at it for a good athletic position, knee not diving in, hips not collapsing, trunks not swaying one way or the other. So this is kind of an example of the FIFA 11. So part one, is the running mobility. That's your jogging, your shuffling, your karaoke. Part two is that more of that strength and plyo, your squats, lunges, different plank variations, jumping, landing, and then part three is that more sport specific. So sprinting, planting, cutting type patterns. Sports metrics focus. That jump training is a little bit more cueing and soft landing, chest up, hips back, track your knees over your toes, working on loading the hip, avoiding that what we call that dynamic valgus, so that knee dropping in and making sure that trunk is aligned, and working on that hamstring dominant and hip dominant progressions, and not just the quads, which some may be very dominant in, especially in athletes. Um, so the benefits are actually much more beyond prevention, believe it or not. So prevention should be enough, but if you do these programs 2 to 3 times for a minimum, 6 to 8 weeks, you actually can improve acceleration, improve agility, improve vertical jump, just better efficiency and confidence. And also, doing it as a team, you build that culture and that accountability. Um, so the other core components, are that dynamic warm up, which is something that should carry over into game. This is not just a preseason type thing, but that dynamic warm up super important, but a key component to all of these neuromuscular reeducation programs. So, you might do some activation type stuff. I mean, band walks, bridges, anything to kind of get the muscles prepped and going. Some mobility work, knee huggers, stretching that quad. The world's greatest stretch, where you're kind of stretching out the hip flexor and working on some trunk rotation all at the same time. And then just some like movement preparation types of A skips, B skips, shuffles, karaoke, that kind of thing are all great pieces of a dynamic warm up. Um, Often say that an athlete shouldn't get on the field. The game shouldn't start until they should be sweating from their warm up. So you got to get the blood pumping. You got to get everything warmed up before the game even starts. So you should have good strength. Should sweat about you before you get on the field. So you know, some of the things I really look at from a core component of strength are Nordic hamstrings, some Bulgarian split squats, single leg RDLs, working on some side planks. So all of these have some very specific things. So the Nordics are for the hamstrings, Bulgarian split squats. You can really start to add some load to that, working on control of that knee position. Single leg RDL, same thing. It's going to be, hamstring dominant, but single leg, so you can really make sure you're working on the outside of that hip. The hamstrings are firing and really working on that good alignment during all these. Same thing's true with the single leg squat. A little bit more, quite a bit more quad dominant, but super important to be able to train on single leg as well as an athlete. And then side planks, with some movement, working on stability and control. Regular planks, amongst those things are key components to the strength. Core, same thing, going back to the planks, you might do shoulder taps, you might do, variations, rolling type planks, you might end up doing like Pallof presses or Copenhagen planks, which works your adductors as well. You know, uh, You might work in some rotational type things if you're a rotational athlete. It'll end up becoming sport specific as time goes on. And each of these programs can be designed specifically for the sport you play. It could be a general thing, but it also could very much be a building block as time goes on. Happy to share different examples depending on the sport as well. So the don't mind this picture here. Um, so key components of plyo: double limb, single leg, side to side type thing, and then you're adding in the rotational jumps as time goes on. And then instead of it becomes a little bit more reactionary. So instead of knowing the movement, you got to react to the movement, and that more mimics an actual game-like situation. Um, for the record, don't mind the visual because I tried to use ChatGPT to look at dynamic valgus and it showed the exact opposite. So if you wonder what dynamic valgus is, it's the exact opposite of this. So the knee actually dives inward. So it's not like essentially this would be accurate if it was showing the left leg, what the red line shows. So disregard that. But cueing wise, good soft landing mechanics, knees bent, chest up. Those are very common cues that we'll give to our athletes. So flexibility, recovery, working on all components, hamstrings, your hip flexors, your quads, your calves. You can do some foam rolling. Hydration is super, super important. It's often underutilized by athletes as well. So if you're out there training, if you're not hydrated, things are going to feel stiff, tired, etc. Stretching alone won't fix that. You gotta make sure you're staying hydrated throughout the process, and then rest. Take days off. Don't do back-to-back days of high level things if you can prevent it, or don't go and play 8 games of lacrosse in a day and a half stretch. You're putting yourself up for potential injury as time goes on. And this is just a sample of progressions of how this would go. So you might do some band walks, some A skips, some shuffles, some bridges, squats, split squats, and then you'll get your kind of planks variations in there. From a plyo standpoint, squat jumps, broad jumps, just working on agility. So sprinting, running forward, and then slowing down. There's actually more stress on your ACL slowing down than actually running itself. Weeks 3 to 6, you might start to incorporate some more single limb type things, some lateral type movements. You might add in those Nordics that I talked about, lunges, your skater hops, which is side to side type movement now. And then week 5 to 6, multi-directional, so it may be straight into the side or rotational. Um, uh, Bulgarian split squats where your back leg is up. Some rotational jumps. You may put some rotational type movements or control work in some of those single leg activities and lunges as well. So preseason, 2 to 3 sessions per week, 20, 25 minutes. That's all we're talking about. In season, 2 times a week. You just got to build this in as part of your warm up. And then you just got to kind of monitor attendance, how often, people are partaking. And then just, paying attention to the movement. If the movement starts to look fatigued, it starts to break down, those are signs that you may be putting yourself, the athlete, in risk of injury. Rest, recovery, and maybe getting back to the fundamentals at this point may be something that's most appropriate. Hot topic, equipment, surfaces, footwear, cleat choices may matter. You may use a different type of cleat depending on the surface. If your foot sticks into the ground, your foot's planted, your body's still moving, you're going to be more likely to put yourself at risk for injury. Worn shoes, if you don't have proper control of the smaller muscles of your foot because of poor footwear, there links up the chain. At the end of the day, you're putting more stress on the joints above the foot. So the knee may be in more risk of an injury. I know this is a hot topic, often refuted, but artificial turf is linked to higher risk of ACL injury. So, playing on grass is going to be best. That's not always something that we control, but just know that there's obviously an increased risk whenever we're putting ourselves on a turf field. And let's just say you do get injured. Let's just maybe not even ACL, maybe just a lower body injury. Really looking at the strength going into it, some hop testing, landing mechanics, psychological readiness. Those are key things. There's no one great predictor of being ready to participate. But at the end of the day, the athlete needs to look like an athlete. They need to have normalcy from side to side, and they need to say that I'm ready to play. And they need to like not be hesitating or be a bit slow because of maybe they're not telling you this, but if they are fearful and they're just a bit late, everything's not going to fire just the way that it should, and actually the risk of injury actually becomes a little higher in that instance. So making sure you truly are ready, making sure you're checking the strength box, the mobility box, the stability box. Um, Before you're going back after an injury is super important. Otherwise, you're just putting yourself at risk for another injury, even a more significant injury down the road. Psychologically, the fear of re-injury is common, not talked about, needs to be addressed. We may get pressure from our peers and our coaches to kind of get back on the field because of their need. Um, that's one of those things we got to really do our best, as I guess, as coaches, to know when the athlete's ready with some of those tests that I talked to you about. And, as an athlete, making sure that you're doing what's ultimately best for you. At the end of the day, if the confidence isn't in there, continuing to train, it'll build. And then, with athletes, it's not very common, but becoming hopefully as athletes mature, it becomes a little bit more normal to communicate, any sort of pain, fatigue, or the issues that they're having, just so they can get that rest day, or you know, uh, they can recover and those types of things. So they're not putting themselves out there, or not saying that they're in pain and then going out and playing, and then having a more significant injury as a result. So long term development, play a bunch of sports, try them all, enjoy them. Um, at adolescents, they do well with a structured strength and prevention program. It's not about lifting as much weight as you can. It's about quality over quantity. Don't specialize too early. Um, and then the goal is to be an athlete or active for life. So it's not about being, the very best high school athlete or getting to the next level. It's about being active and being able to stay active for the long term. So knee injuries can prevent your ability to be an athlete for life. So protecting yourself young is super important. Um, Key takeaway here: ACL injuries are common. Up to 200,000 of them a year, but up to 70% of them are actually preventable. These programs I talked about can cut the risk anywhere between 40 to 75%. They'll actually also improve performance, which the athletes like, and it doesn't take hours of training a week. We're talking 20 minutes 3 times a week. So an hour a week to dedicate to prevent an injury, to me, doesn't seem overbearing. Um, and then the big thing is that you got to protect your knees, protect your future. So what are the rules for everyone? So coaches, parents, lead the warm-ups, make sure that you're setting those standards, you're tracking their adherence. Parents, make sure that you're supporting the sleep, the nutrition, consistency with the programming. Talk about the warm-up, make sure that the pressure from the parents not there, that the athlete needs to go out there and perform if they're not up to 100%. Um, and then the athletes, you got to own your technique. You got to be open to reporting pain. And you got to focus on rep quality over quantity. And that's what's going to build success. So, once again, ACL injuries are common, preventable. Consistent coach led neuromuscular program works. It also improves performance, and everyone has a role in all of it. So, um, hopefully you all got something from this. If you have any questions, feel free. I'd be happy to chat a little further in the comment section. Otherwise, hopefully everyone that watches this is introduced to the neuromuscular training programs, and hopefully at some point takes part in those to prevent themselves from risk of injury. So thank you everyone for your time.